On behalf of the Health Professions Pathways Program at Gonzaga University, hello and welcome to Pre-Health Application Bootcamp. This is intended for candidates who are applying in 2023 to start a health professions graduate program in 2024. The goal for this session is to review select parts of the application process, give you some tips and resources for how to navigate those, and also give you some tangible action steps that you can take right now as you gear up for the 2024 application cycle. These are the topics and activities that we're going to roll through today as part of the session, starting with several different resources that can be helpful for you as you navigate the application process. We're also going to make sure that we touch on centralized application services and make sure that you understand that part of the process. Give an overview of the timeline and what you can expect moving forward if you're applying the cycle. Briefly touch on requirements that you are going to need if you are submitting applications to programs this year, and then spend some time talking about letters of recommendation and also activities or experiences that you're going to want to share with an admissions committee. There are some topics that we are not going to touch on during this session, and in part because we are hosting some dedicated sessions on those topics. One opportunity to learn more about the application process would be to connect with some alumni at a panel we are hosting on February 27th. There is the chance to talk with alumni that have been accepted into or are currently attending graduate schools in different healthcare professions or are currently practicing. We're also going to have dedicated sessions to talk about personal statements and other essays, and also about how to research and select schools to which you want to apply and how to come up with a really targeted list that matches your metrics and interests and needs for your particular programs. We're also going to host really a drop-in application Q&A in May, and then offering some opportunities for interview practice a little bit later this cycle, and that will happen over the summer. ZAGS Ignite is a way that you can stay up to date on all of the workshops and sessions that we're hosting. So if you're not familiar with that resource already, would encourage you to make sure you are connected at gonzaga.edu/ZAGSIgnite. One new resource that we're really excited to be launching this application cycle is our pathway. This is for candidates who are intending to apply as part of this application cycle. And so we've launched a pathway in ZAGS Ignite that is the H3P application cohort 23-24. What this does is offers a real online self-paced checklist for you of what are the action steps that you need to be taking as part of the application process. It also will feature all of our workshops for this cycle and some really career specific resources. So today and in some of our other sessions, we will speak to all of the health professions, but tapping into this pathway will unlock a lot of career specific resources. So if you are applying to medical school or PT school or occupational therapy, we'll have some more specific resources. So if you're interested, we highly encourage you to join this pathway. It's also a way that we can keep tabs on who is planning to apply this cycle and offer additional communication or resources to those students. Please join the pathway at gonzaga.edu/ZAGSIgnite and navigate to the pathway option. This is what it will look like when you log in. You'll select pathways from the home screen, select the application cohort, and then start to join. And then from there, you really just check off the steps as you complete them. So it's a way for you to really track your progress and be aware of the resources and workshops we have available to you as part of this process. There are so many resources that are available to you if you are applying the cycle. Want to make sure that you're aware of them and how to access them. Some of them are really people focused, and that might be school information sessions. So that is how you can get a lot of school specific information. Oftentimes those info sessions are offering really great tips about, generally speaking, the application process. So helping set you up for success. The great thing is many schools and programs are hosting these opportunities virtually. So even if you are not closely located to a program or you're interested in a program that's across the country, there is an option for you to join that from a virtual location. Admission representatives at different schools are also a really tremendous resource. There are questions that as advisors we can answer for you, but oftentimes there are questions that are really dependent on a school. Maybe it's whether a school will count a particular course or really what they're looking for in a program. That is a great opportunity to connect with somebody in admissions at a school, and you're highly encouraged to do that in a really professional and thoughtful way, but please reach out to them if you have questions. Current graduate students can also be really great resources. It was mentioned earlier that we're hosting an alumni panel, so that's one opportunity. You can also tap into our alumni network and connect with students who have successfully navigated the application process. Certainly, everybody has their own path to health professions graduate programs, but our alumni and others who have made it to their educational goals can offer really great insights on, tips related to interviewing or, managing all of the essays, or they can also sometimes share things that they wish they would have known. So tap into that as a resource if you think it would be helpful for you. In addition to the people resources, there are also some organizational resources, and one of them would be the professional associations for your respective fields. Some examples might be the Association of American Medical Colleges if you're applying to MD or allopathic medicine, the American Dental Education Association if you're applying to dental schools. So know your professional association, because what they can offer are webinars related to the application process, where they will talk you through what you should be doing for each section and offer kind of some troubleshooting tips in advance. Maybe you have some AP coursework or study abroad coursework that you're going to need to enter into your application. They can really walk you through some of those tricky pieces. They also often coordinate virtual fairs, so virtual grad school fairs, where they're bringing in, potentially hundreds of schools in your field into one event, and you can connect with those admission reps and ask questions all on one day. So those are really great opportunities. The professional associations also offer really great tips that you can access online or application guides. So make sure that you're tapping into those resources as well. And then finally, really understanding your centralized application service. This is really your de facto common app that you are going to use to apply to medical school and dental school and PA school and so on and so forth. So make sure that you know those resources, that you know the website, the help resources that are available. So that is really an action step that you could take right now. If you don't know what your centralized application service or your common app for your field is, that's something to do right now. So find your CAS. Also to check on what is the open date. We're going to talk about deadlines here in a little bit, but understanding when is it going to open for your cycle that you can start entering in information into your application service. And then also another tip would be to find the help center and or an applicant guide for your application service. Find that on your computer, bookmark it so that you have access to that resource and know how to navigate it if you have questions about, for example, how do you enter in letter of recommendation requests? How do you enter your coursework? How do you submit your test scores? All of those questions can usually be answered by the help center or an applicant guide. A couple of notes about centralized application services. If you are applying to medical school, you are thinking about applying to MD and DO programs, so allopathic medicine and osteopathic medicine, you are going to utilize two different centralized application services. If you are somebody who is applying to a medical, dental, or veterinary program in the state of Texas, they have their own centralized application service that is separate from the main one. So when you are looking up your website, make sure that you are understanding if you have one or if you have multiple. Another note about centralized application services is for some professions, not all schools will utilize a service like this. Nursing is one example. So if you're looking into accelerated nursing programs or nurse practitioner programs, many of those schools use nursing CAS, but not all of them do. There are some fields, chiropractic, for example, does not utilize a centralized application service. So while this is very common and while most health professions fields utilize this to navigate their applications, it's possible that you will apply directly through school. So really make sure you understand the process. If you do have a centralized app, again, what this service does is it takes all of your information, your transcripts, your letters of recommendation, your personal statement, all of your biographical information, and it disseminates it to the schools to which you want to apply. So it's really important that you understand what that system is going to be based on your profession. We're briefly going to go over an application timeline. This is really going to be dependent on your field and also, different nuances based on your particular situation, but just to give you a sense on what you can expect. Some things that you might have already been thinking about or should continue planning for from fall 2022 to spring 23 are kind of evaluating your candidacy. Am I ready to apply this cycle? And if so, what are the things that I'm doing to prep for that? Also, if you have not done this already, to be researching the requirements you need for your program and specifically for the schools that you think you want to apply to. So making sure that you are understanding prerequisite courses that might vary from school to school, making sure that you understand the standardized exam requirements, learning about the application process. So you're attending this session or viewing this session, which is really great. You're well on your way, but diving more into it, understanding the timeline and the requirements, knowing your centralized application service. Beginning to compile a quote unquote resume of experiences that you will share with an admissions committee. We'll talk more in the session about activities and experiences, but really starting to think about what do I want to share? And then if you have not yet taken your standardized entrance exam, that's something that hopefully you've started to think about and are doing already. Spring is a really great time to be requesting letters. We'll spend some time talking about that. And also at some point to begin drafting your personal statement. This is something that you should be working through multiple drafts on. So writing it, setting it aside, and coming back to it. It's an important part of the application process, so not something that you're hopefully waiting until the last minute to complete. To start pre-writing some of those experiences and activities, again, we'll touch more on that later this session. Finalizing a school list. Technically, that's not something that you need to do until you actually submit your application, but the more firm you can have that list, the greater understanding you will have about the different requirements you need, whether that's letters of recommendation, standardized exams, the cost of applying, because for every school that you apply to, that's an additional cost. And then if you have not yet, make sure that you are taking your standardized exam or are registered for it. Really, anytime between like April to July is when applications are open. Technically, the veterinary school application opens earlier, but you can start submitting it in May. But really, we're talking late spring to midsummer is when all of them open. So that's when you're starting to work on your application, and the goal is to submit early. We'll touch more on that here in a minute. From summer to fall, again, you're submitting your application and you're working on either secondary or supplementary applications. As was touched on earlier, your centralized application is what goes to all schools. So you will have one personal statement that's going to all schools. But many programs have what's either called a secondary application or supplemental application questions, in which you are answering very school specific questions. They might be, why are you interested in this particular school? Or questions that relate to that school's mission. And so you're working on those kind of in the later part of the summer. If you have to take what is called a situational judgment test, two examples are up there, the Casper or the Preview. Summer kind of is a good time to take those. Many med students, for example, will take that after they submit their primary application and while they're waiting for their secondary application invitations. But make sure that you're understanding when those situational judgment tests would be due. The situational judgment tests are ethical scenarios that you are presented with and need to explain how you would respond to them and why, just to give you a little bit of an overview, but would really encourage you to research requirements for those, make sure that you are prepping for those so that you understand what's going to be expected of you if you are required to take those. And also make sure you understand that you are only able to take those tests once per application cycle. So make sure that you are really prepared for it that day. If you don't feel that you really perform well on that day, unfortunately, you're not able to retake it. So make sure you do your due diligence. Later, starting in late summer and really all the way through late winter is the opportunity to participate in interviews. The dates for those really depend on the school and also when you are submitting your application. So again, interviews can continue depending on the program, potentially through March. So after that, it's really a waiting game and you're waiting to hear about decisions. Depending on the program, you might know if you've been accepted in the fall, you might need to wait all the way until the spring. So you might hear that you have been accepted, that you have not been accepted, or there are wait lists as well. So just navigating that process through the spring. All throughout the application cycle, while you are working on your application, you should be continuing to gain experience. That can be work experience, it can be healthcare experience, but something that you are continuing to build your resume. This is important for a couple of reasons. One, if you are invited to an interview, it gives you something new or additional to talk about. Maybe you're continuing in a role, but you have additional responsibilities that you can share in an interview. Or maybe you've started something new since you submitted your application. So those are good things to add. It's also really important to recognize that all of these healthcare programs are very competitive. And so you want to be thinking very positively about your application in the hopes that you are submitted or accepted this cycle. But the reality is there is a potential that you will not be accepted. If that is the case and you end up in a position where you need to apply next cycle, you want to be seen as a different applicant on a second try. And if you have not done anything between when you submit your application and when it's a resubmit, there's not anything new for a school to evaluate. But if you have continued to build your resume during the application year, you have a lot more to show a school that you've been committed to this field, that you've been committed to personal growth, that you've learned new things, that you've built new skills. So make sure that you're doing that in the event that you need to reapply. If you are accepted, all of those really great skills and experiences that you gained during the application cycle will just make you, all that much more prepared for your program. Want to touch on deadlines here and make sure people are really understanding what those mean. As you're navigating your process, you might see several different types of deadlines. You might see early decision, priority, final, or rolling decision or rolling deadlines. Early decision is offered through some programs or some schools. There is some risk involved. It can be beneficial for some students, but if you are considering that, would encourage you to reach out to an advisor or a school for more information and to discuss your situation. Priority deadlines usually mean that they will consider applications up to that point, and then after that date, only if spots are available. Final deadlines are pretty much what they say. If you submit after that date, you will not at all be considered. Most health professions graduate programs, however, use what we call rolling admissions. What this means is it will open on a particular date. Let's say for MD programs, it's May 2nd, and they are receiving applications and reviewing them as they are received, and it's on a rolling basis, hence the name. Why this is important is that health professions grad programs have a set number for their cohort. It doesn't fluctuate from year to year. So if they accept 100 students one year, they're going to accept 100 students the next year. They're looking to fill all of those spots because we need healthcare providers of all kinds in this country. However, they're not going to overfill a class. And so again, as applications are being received, they're reviewing those and making decisions about who is going to get an interview. And then from there, who is going to be accepted or who is not, or who's going to be waitlisted. So what this means is, as the process continues through the cycle, it becomes more competitive because spots are starting to get filled. The encouragement then is to apply early in your cycle. Please don't rush your application materials. If you're still working on your personal statement, or if you're still working through some things, you only get one opportunity to submit your application. You don't get to edit it once you submit. So make sure it's really solid, but you do want to apply early so that you have the greatest opportunity for those interview slots and for those final slots in the class. Remember, especially if you're looking at deadlines and for programs that have priority deadlines, that your centralized application service needs time to verify your application. So there is time from when you submit it to the centralized application service to when a school will actually submit it. For some fields, it's 10 days. For others, MD it takes the longest, can take up to 6 weeks. So make sure you're factoring in that time when you're thinking about a potential deadline. But ultimately, a deadline really should be viewed as the last possible date you should submit your application, rather than when you should actually submit it. So really think about when's the ideal timeframe for you to submit your application. If you have questions about that, that would be a great question to reach out to an advisor for. Requirements. If you are applying this cycle, you should have a good sense of what are the things that are going to be required of you, or what are the things that an admissions committee is going to be evaluating you on. But here are just some reminders and some things to really focus on as you get ready to apply. One is that there are general and school-specific requirements. An example would be that all dental schools are going to require the DAT, but schools might have minimums of what they will accept in terms of a DAT score. So make sure you're really understanding the school-specific requirements when it comes to GPA, prerequisite coursework, standardized exams, letters of recommendation, observation hours, and lots of other parts of the application. Make sure that you are sending your transcripts. A note here, remember that you need to send transcripts from any institution that you've taken college level coursework. So if you were somebody who did Running Start, if you have taken coursework at schools other than Gonzaga, maybe you needed to do some prereqs over the summer or after graduation, you're going to need to send transcripts from those schools. So make sure you're really focusing on this information. In addition to focusing on that information, really encourage you to try and organize those requirements. It can be really difficult to try and remember who needs what and what is the range and what's the minimum for this school. So a spreadsheet is a really great way to organize that information. If you have another organizational tool, I encourage you to use that, but spreadsheets can be really helpful. This is just an example of what are some of the factors or fields you might include on that spreadsheet. Sometimes, especially if you're using a spreadsheet and you really like to go into a high level of detail, that might become really unwieldy. So use different tabs on that spreadsheet. Use different spreadsheets for different type of topics. But whatever you do, organize your information so that you know what's going to be asked of you for each school. Going into letters of recommendation, which was one of the requirements that you're going to want to research, two big questions to ask yourself and to research are: how many do you need? This is going to vary by profession. Some professions look for more letters than others. It's also going to vary by school. Same goes with from whom do you need letters? Some programs and some schools are pretty open. They might say you need 3 professional letters. We have no preferences, but here are some ideas. There are some programs that are very specific, and they will say, for example, we want 4 letters. One has to be a science professor, one has to be a non-science professor, one has to be a work supervisor, and the last one has to be a healthcare provider. So make sure that you are researching that information. And I would add that to a spreadsheet or some other place that you are capturing that information. Once you have a really great sense and start to do some research, you might start to see some continuity or some consistency. Then you want to start identifying individuals that can support you and can write you strong letters of recommendation. These are people who know you well, that can really speak to different qualities and characteristics and strengths. So really focus on that. And then make your requests. You want to make sure that you're giving plenty of advance notice for those. And so this could be something to think about. If you're a current student, probably by spring break, you want to make some initial asks. If you are a graduate, thinking spring break is mid-March, so that timing would probably be pretty great to start reaching out to folks or rekindling relationships that you might have had as a student, thinking about people who you might be working with or volunteering with currently. So make those requests and know that you might be following up later with additional information, because what you should be doing is providing those individuals with information that can help aid in their writing. So asking them to write a letter, but then saying, here's why I'm asking you to write this letter. I really think that you can speak to this quality, or I'm really hoping that you can highlight this experience that we had together. So a couple of action steps to take right now would be to start researching those requirements. How many letters? From whom are you going to need letters? Do you have relationships with all of those people from whom you're going to need to request letters? Do you need to retouch base with people that you've fallen out of contact with? Brainstorm a list of potential letter writers, and then review the resources that are on the H3P, the Gonzaga Pre-Health website. We have developed some resources that can be really helpful in navigating the letter of rec request process. This is on the website, and one of them is the guidelines for requesting letters. This provides even more tips and questions to think about, some recommendations of folks you might want to think about asking to support you, some tips on how to make those asks, and then how kind of some logistical pieces. We also have created a request form, and this is something that you can use, and we encourage you to use after you've made an initial ask and somebody has agreed to write you a letter, to provide them with some information about how you have connected or how you've engaged together. So if it's a professor, reminding them of the classes that you had with them, reminding them of major projects you worked on together. If it's a work supervisor, reminding them of, your major responsibilities or some key accomplishments that you've had. Maybe you are asking someone to really speak to the growth that you have achieved and providing them with some specific examples. So these resources are all here, and you are encouraged to utilize them as they are helpful for you. Finally, want to touch on the idea of experiences and activities and what you are choosing to share with an admissions committee. Again, starting with some questions. What experiences do you want admissions committees to know? Some schools might really spell out for you the types of experiences they're looking for. Something like hands-on patient care experience, volunteer experience, shadowing, but being really inclusive about what are other parts of your story and your journey to this point that you want to make sure that schools know about. Really making sure that you are including those things that have helped you learn about the healthcare field, recognizing that schools want to know that you've done your career discernment already before you get to their program. And then what are things that have helped you build valuable skills and competencies? What are some of those transferable skills, even if it's not healthcare related? Let's say you held down a job your entire time through college and it was, something in food service or something in customer service. In those roles, you are connecting with people and you're helping people and you're having to work with people that are, maybe are difficult or have a lot of needs. That's something that you would be facing in a healthcare setting. So be really inclusive of different types of experience. Even if you don't think it's relevant, there's probably some sort of value that you got from that experience, even if it's not clinically related. Also, be reflective. There's not a whole lot of space on the application to talk about the experiences, but as much as you can, share what are some skills that you gained from that role or that you developed or were really able to demonstrate. What are some accomplishments you had? Try not to just focus on the what you did, especially if it's something that everybody's really familiar with. So let's say you worked as a barista. Most people really know what a barista does, but tell me what you got out of that experience. Tell me how you grew. Tell me what you really enjoyed about that experience. Same with being a medical scribe. A lot of people know what a medical scribe does, but tell me what was unique about the role that you had, or what did that teach you about working in the setting that you were in. The encouragement is to focus primarily on experience since starting college. There might be some exceptions, especially if something's really relevant. For example, if you have animal care experience that was prior to college and you're applying to vet school, or if you have something that is really just super impressive in terms of hands-on patient care, but your centralized application service will direct you on what you can include. But again, programs are primarily looking for what you've done since starting college because that's more recent. Schools are also primarily evaluating you based on what you have already done. Some centralized application services will allow you to enter hours that you have not yet completed. That is a great way to show that you are continuously engaged in healthcare spaces, or that you're planning to volunteer, or that you're planning to continue working. However, if you are banking on those experiences to make or break your application, let's say you haven't had any shadowing experience yet, but you're going to do that in the next year, would highly encourage you to think about if this is the best time for you to apply. Because it's hard for schools to know what you have gotten out of an experience if you have not yet done it. So there's a difference between continuing an experience you've already had, or having a new experience that you are just really excited about and might be the icing on the cake, or something that you want to do in a gap year, but not necessarily something that is going to make or break your application. So really think about that. Also, just a quick logistical note, in terms of shadowing or observation hours, there are a couple of fields, most notably physical therapy and occupational therapy, that may require your observation hours to be certified. So just make sure that you are following all instructions related to that and touching base with folks if you need to. In terms of activities, and a real tangible step that you can take right now would be to brainstorm a list of everything you want to list on your application. And again, being really inclusive. If you had a job, if you were engaged in service, research experiences, other really valuable things that you did, in addition to the shadowing and the other things that are going to come to mind: club experience, leadership roles, mentoring, tutoring. And would encourage you to, as one of the ideas early in the spring was to start pre-writing some of your activities. So maybe take down a few minutes today and choose one of those activities on your list and think about, what did I do? Kind of the logistical, tasky things, but also, why was this experience valuable or impactful for me? That's really the digging deeper piece, and that's telling a lot more about you to an admissions committee than just what you did. So now that we've gone through several parts of the application process, just want to wrap up with a few tips and reminders about resources. One is to start early. This is a long application process. Again, it's at least a year out from when you're wanting to start school. Set yourself up for success. One example is to write multiple drafts of your personal statement. We talked about that a little bit earlier, not sitting down, the night before you want to submit your application and writing it all in one setting. So really think about pacing yourself through this application process, creating a timeline and a plan for yourself, but starting early so that you can keep up with the competitiveness of the cycle. Similarly, really staying organized. We talked about one opportunity to use a spreadsheet with regard to all of the school-specific requirements. You could also use a spreadsheet as kind of a timeline for yourself on when you want to have certain tasks completed. You could use a project management tool online. You can use a to-do list, a planner, whatever works for you. But the key is really to stay organized. The application process is stressful. There's no way to sugarcoat it. It's stressful because this is something that you really want. You've been working so hard and preparing for this next step in your career journey, and it takes a lot. There is a lot that's expected of you. Your ability to stay organized is not going to completely eliminate that stress, but it will help you manage it. For example, the more you understand the application process, the fewer surprises there should be. If this is the first time that you heard about a situational judgment test, at least you know about it now and you can plan on it versus getting later into the summer and having to scramble to register for it at the last second and not performing very well because you didn't know about it. So stay organized as best as you can. Leverage your resources. We went over several resources at the beginning. Use those as much as you can. There are many people and tools that are available that you can meet one-on-one with people. You can access information online on demand. And think about asking thoughtful questions that are really going to help you understand parts of the process, understand your situation. Asking thoughtful questions, especially when it comes to admission reps, means putting your best foot forward. So doing some research ahead of time and not asking a question, for example, that's really obviously listed on the homepage of their website. Do a little bit of research and then ask something that's unclear. Maybe they have information about letters of rec, but they have conflicting information. Or maybe you want to dig a little bit deeper and understand more specifically what they're looking for, or if something would count. That's a much more thoughtful question then. Can you tell me information about your letters of recommendation requirements? And then finding this balance of, taking ownership of this process and asking for help. So doing that research and knowing when it makes sense to answer questions, leveraging those tools and resources appropriately, that's going to help you understand and build valuable skills such as critical thinking and decision making. So, take agency and have control over this process. But yes, ultimately, when you are struggling and when you are feeling lost, reach out to those resources and ask for help. Again, just a reminder about that pathway that we have available through Zags Ignite that's going to dive really deep into some of those career-specific logistical pieces of the application process. It's going to help you hopefully stay organized and know what are a lot of the action steps that you're going to need to take. So encourage you to sign up for that. It also helps us keep tabs on who all is going to be applying this cycle so that we know, what is needed in terms of support. So sign up on Zags Ignite, gonzaga.edu/Zags Ignite. If you have other questions, encourage you to reach out. The Health Professions Pathways Program or H3P website, the QR code is on the left. So that has a lot of great information about the application process and links to different resources. And then Zags Ignite is how to, 1, sign up for that application cohort pathway, 2, know and stay up to date with all of our workshops, and then 3, be able to sign up for individual meetings. I hope that this session was helpful for you to get an overview of the application process, dive into a few parts of the process and requirements, and give you some action steps that you can start working on right now. Make sure you're leveraging resources appropriately, and good luck.